Shoshana Weissmann, thank you so much for joining us from the remote R Street studio, as well as Gritty. We appreciate you coming on board for Policy Gone Viral. I want to jump right in and talk a little bit about the economy specifically. With the pandemic kind of grinding the economy to a halt, a lot of emphasis is being placed on occupational licensing, deregulation. We've been talking about it and doing work on it in Florida. What can you make the connection for us on why this is an important topic for right now?
So the pandemic is focused in certain localities, especially like Washington State, New York, Louisiana, among others. But that means that doctors from other places might be able to help in those places, whether virtually or in person. So telehealth regulations or even doctors traveling across state lines can't always practice because you have to be licensed where you're practicing. And it depends on the state exactly how it works with telehealth. But both that nurse scope of practice reform and pharmacist scope of practice reform are all really important right now, because you want to make sure medical professionals can go where needed and that other medical professionals can kind of reduce doctor burnout. So all that, in addition to certificate of need laws, are really important because those are really big problems with reducing access to healthcare. And no time have we needed better access to healthcare than we do now.
Looking specifically, I'd like to take a moment on each part of it, kind of the healthcare space and then the broader space. Looking at the broader space in Florida, we've passed just recently a fairly robust occupational licensing deregulation bill. As the economy begins to kind of want to kind of turn the corner as the pandemic dies down eventually, how will that reform impact the ability of Florida to recover more quickly than otherwise?
Well, the regulatory reforms passed are fantastic in Florida. I've been watching really closely, and it's great to see you have some great state legislators and a great governor down there helping with that. But they've passed some really important reforms, just allowing people to get to work more quickly. There's basically, whenever you have any regulation, it's going to reduce access to the service, it's going to raise prices, and it's going to make it harder for the poorest to get into the workforce, because even if they can get student loans, there's still that opportunity cost and people need to feed their families. But these regulatory reforms will allow Florida to get back to work a lot more quickly in the areas in which they're implemented. And in the meantime, it's doing a great job of increasing access to care.
And on the healthcare side, we've also passed last year's certificate of need repeal of most of them, as well as this session, we just did scope of practice, as well as allowing pharmacists to test and treat for things like strep and flu. And this kind of speaks to what you were talking about and wanting to kind of increase the supply of practitioners and get people access to care, especially at a time like this.
Definitely. I couldn't believe how serendipitous the timing was that passed right before all this happened. And I'm really hoping that that will do a big chunk of helping Florida.
Thinking ahead, what are some of the policy fixes that, either in healthcare or in the broader occupational categories that you see that we should be making momentum on?
I mean, all reform where possible. Basically, if Florida has licenses that other states don't, compare rates of harm between the states, see if those licenses are worth it, and if they're not, just get rid of them. I was really encouraged to see the nutritional licensing reform because the military spouse, Heather, who moved from California to Florida and then had sting operations done against her for giving diet advice without a license. That was awful. So any areas where we can reduce that harm, and also any regulations, and these are generally more local regulations where they stop home-based businesses or they stop people from feeding the hungry. Those are really, really bad regulations at a time like this, when we want people to stay home and when we want to make it a little bit easier to feed the people who need food.
Yeah, absolutely. So your work at R Street is phenomenal. Where can folks go to get more information if they want to find out? They know about JMI. If they want to find out more about R Street, where can they go?
Thank you. Just rstreet.org. We have a whole section on coronavirus now, mainly just random policy implications from regulations to budget and justice.
Excellent. Thank you so much again. We really appreciate the opportunity to have you on here, and we look forward to working with you closely as we kind of turn the corner on this eventually.
Same. Thanks for having me.
So who is that character?
Gritty. It's Gritty.
From?
Like Gritty, like the Philadelphia mascot.
Oh, okay. Nice. Well, I'm going to send it. I've got a couple of friends in Philadelphia, so I'm going to send this one to them.
Oh, cool.